I remember yelling at my parents, why me? Why can't they find out what's wrong?
I said, God, this isn't fair. Leave this family alone.
Tonight, two medical mysteries that defied the experts. 5-year-old Connor Rowley is plagued with a mysterious fever that won't go away. His doctors can do nothing for him, and his family fears for the worst.
I had one of the siblings ask me if Connor was going to die.
Next, for LaRue Hawley, getting sick was terrifying. But when no one could find anything wrong, it became a nightmare.
I felt like this is over. I guess I'm gonna die and not know what in the world was ever wrong with me.
September 10th, 1993. Connor Rowley is born. 8 pounds, 13 ounces. It is an especially joyful time for his family. Just a year earlier, they were mourning the loss of another child.
We had another son named Sean, and he died from some lung complications when he was about 17 days old. And so when Connor came along the year after that, everyone, all the siblings were just protective of him.
Oh, he's a clown. He's a great kid. I guess you could call him the baby of the family, but he's just one of the gang.
He's very playful, very inquisitive. He's got a very, very special place in my heart.
Connor is a perfectly healthy little boy and gives his parents no worries. Until his 5th birthday, when they notice something strange.
So his friends all came over and we did the cake and everything.
Connor was not himself. When the other kids were playing, Connor would not participate as much as you would normally expect him to do.
Later that night, Connor seems to get worse.
He was sick to his stomach, and then he had a fever. And so we waited a couple days to see how that would turn out. It lingered for a period of time after that.
At first, Chris and Dave assume it's just a stomach bug. But as the week goes on, Connor's symptoms evolve into a weird pattern.
Every day he would wake up and feel pretty good. And then in the afternoon he would begin to spike a fever, and Connor's fevers would go anywhere from 101 to about 104. And then in the evening the fever would break and he would be just drenched in sweat.
There'd be a puddle of sweat on the small of his back, and it just literally, his sheets would be soaked.
I'd never seen that happen with any of my kids before.
It took a little while for us to recognize that this was not the flu. This was something a little bit different.
Chris calls their family doctor and describes Connor's symptoms. He says it's probably nothing to worry about, but tells her to watch Connor carefully. 5 days later, Connor is no better. In fact, he's worse.
He would have severe tummy cramps several times a day. It was so severe that he couldn't even stand.
He would be doubled over in the fetal position on the floor. It's heartbreaking to see a child at that age curled up on the floor.
It didn't get better. He didn't show any sign of improving, so my mom alarms began to go off.
This time, Chris takes Connor in to get checked out.
The doctor was thinking in the beginning that Connor might have had a parasite or a bacterial, so they did a blood draw.
While they wait for the test results, Connor is put on an antibiotic, just in case.
All the cultures came back negative. They didn't see any bacteria that they could find or any parasites.
Their doctor is mystified. To be safe, he keeps Connor on the antibiotics for a few more weeks, but the 5-year-old doesn't get any better.
I could be at the grocery store with him and he'd suddenly just bend down and lay on the floor.
It got to a point, honestly, that Connor could not even, walk 100 feet without getting tired. You could tell he was wearing down. And you're wondering what's going on inside this boy. And it was quite a mystery.
But LaRue Hawley was healthy and active until the year she turned 15. One day in class, she noticed a strange problem. She didn't realize it then, but it would change her life forever.
It felt like my tongue, like my inside of my mouth was getting enlarged. I felt like my tongue was bigger than everything else in my mouth. I started noticing that my speech was becoming slurred. I couldn't pronounce some of the words, and some of the kids were like snickering in the background.
At first, LaRue blamed the episode on a bad sore throat. But over the next month, her difficulties with speaking and swallowing came back. Then she started noticing weakness in her hands and legs.
I didn't have any strength. It was difficult to sometimes pick up a glass of water.
Sometimes she would say that she was tired, but we thought sometimes that was so to get out of studying or whatever.
Probably the next month, I started having the droopy eyelid, and the eye wouldn't stay focused on one thing. It would drift. I started noticing that I was having problems with just an everyday smile. My lip would turn up. I had no control over it. Symptoms were so unpredictable, I didn't know what to expect because every day was different.
For 2 years, LaRue kept her symptoms to herself. Then, in December of 1988, she met Brian Hawley, a 20-year-old Army paratrooper.
I didn't know really what to tell Brian. I knew that I had to tell him some things that were going on, but I didn't know how much.
Probably April 1989, I asked her about her symptoms. Why are you having difficulty talking? What do you think it is? And she would never comment really on what she thought it was or felt it was.
Eventually, it gets so bad that the Rowleys are forced to pull Connor out of school. Over the next 3 weeks, his painful symptoms persist. Stumped, Connor's doctor refers him to a pediatric specialist, Dr. Scott McKercher.
Whenever a patient like Connor has fevers for a while, you start wondering, okay, is this something simple like a pneumonia or a sinus infection or a bladder infection, or is there something else brewing? And then I said, you know what, we need to look for some more unusual things for this fever.
Dr. McKercher orders dozens of tests.
He took a lot of blood from Connor, and we were not prepared for that. We were just shocked. They took 8 vials of blood.
We looked for just a variety of different things. We looked for lupus or rheumatoid arthritis. We did some tests for typhoid and paratyphoid, which are bacteria infections that can sometimes cause unusual fevers. And unfortunately, really all of those tests came back normal.
LaRue was ashamed of her strange condition and reluctant to discuss it. Then one night, her symptoms flared up during a date with Brian.
We were at a restaurant, and we were eating and everything, and all of a sudden it felt like my throat was literally closing.
She started to eat some steak, and it just became lodged in her throat, and she couldn't get it out.
Brian had to come around the table and perform the Heimlich maneuver on me.
That night, LaRue came clean to Brian about all the symptoms she'd been suffering over the past 3 years. But her parents wouldn't find out until later that spring, when she fainted at school.
The way that I felt was at that time was, how did I miss it? But I guess when it's right there at home, you don't see it unless it really jumps out at you.
Well, my mom, she broke down crying. She was like, you know, why didn't you come and tell me?
LaRue's parents drove her straight to the family doctor.
And so we waited in the doctor's office, and he took me back. And he basically came to the conclusion that I probably wasn't getting enough sleep. I was overexerting myself.
The doctor advised more rest, but when LaRue's condition didn't improve, he referred her to a specialist.
I got an appointment with the ears, nose, and throat doctor. He performed a strep test. I didn't know what the results were of the strep test, but he told me he wanted me to take this antibiotic. So I went home, started the 2 weeks of antibiotics, no change at all. Went back to the same clinic, but had a different doctor. They prescribed another antibiotic, went home, nothing happened. So I came back for another checkup with another different doctor in the clinic, and this doctor proceeded to tell my mom and dad, you know, she's had all these antibiotics, she's not getting any better, maybe it's all in her head. Maybe she's just doing this to get attention.
If LaRue wants attention, LaRue will get in your face. She'll get there right in front of you and she'll say, Dad, you're not listening to me.
And I remember yelling at my parents, you know, why me? Why can't they find out what's wrong?
Chris's frustration begins to grow. She can no longer just sit by and watch as her son gets worse and worse.
She would spend then the late hours at night doing the research, keeping more logs, keeping more notes, finding out anything she could about anything she heard a doctor mention, just so she could try to better understand what might be going on.
We found out that night sweats are a sign of some of the different chronic diseases, things like cancers, things like juvenile rheumatoid arthritis. And so it made us all very alarmed.
In the meantime, Connor is virtually wasting away. In the 2 months since his symptoms first emerged, he's lost 10% of his body weight. The Rowleys feel like their son is dying right in front of their eyes. Racked with worry, Chris and Dave pack Connor into the car and drive 170 miles to a research hospital for a complete workup.
My largest fear for Connor was that he would have cancer, quite honestly.
They had all kinds of people seeing him. They had GI people, that is gastroenterologists. They had infectious disease people. They had hematologists or blood doctors take a look at him.
You know, we just had to eliminate all the things that he didn't have.
Connor's severe stomach pains raise suspicion among the new team of doctors, so they order a series of gastrointestinal exams to get a picture of what is going on inside the boy. First up is a barium X-ray.
A barium swallow test is trying to take a look at how fluids goes through your intestinal tract. So they take an X-ray, so you're getting the liquid going down your esophagus, and then you're watching it splash into your stomach through into the intestinal tract.
But the results of the barium test are inconclusive.
It showed that in the upper part of the intestine there was just some prominence of what they call the folds, which is kind of the lining. It was really pretty nonspecific though. The rest of his small bowel series they interpreted as being normal.
Meanwhile, LaRue was having more trouble swallowing. Afraid to eat solid foods, she became dangerously thin.
She probably lost 20 pounds in the few months that she and I had been together. LaRue's 5'3", and I just, weighing at 89 pounds or 85 pounds at that height was, to me, unhealthy. Every time you turned around, it was like the worse her symptoms got, the more she couldn't eat, the more weight she was losing.
Scared and confused, LaRue went to see yet another specialist.
And this time I was seen by a cardiologist. The cardiologist gave me the stress test and basically told my mom and dad, she is a female, she has a menstrual cycle, maybe she's not getting enough nourishment and that's why she's fainting. I started noticing that I was getting the sniffles. And I didn't think nothing of it, but after I left school that day, I felt like I was developing a lot of fluid in my lungs, and I started noticing that I wasn't able to really speak clearly.
LaRue's family rushed her to the hospital that night.
When we got to the emergency room, the ER physician that evening saw LaRue and decided that it was just a mild case of sinusitis. And he had given her a prescription.
The doctor, before I left the emergency room, was like, we want to at least get 1 dose of the antibiotics in her because of her fever being so high. Well, we sat there for hours because I literally couldn't swallow the pill. My mom took the antibiotic and shoved it down my throat with her 2 fingers.
After we got home, we started to see more symptoms in LaRue's breathing. She started to gasp, wheeze more. She started to have purplish lips.
I told my mom and dad, I said, I feel like my chest is going to shatter.
Every time she would take a breath, you could just hear the crackling in her chest.
My oldest brother, Richard, came into the room, and I remember him leaning over the bed, looking at me, and he turned to Brian and my mom and said, "If we don't get her to the hospital now, she's gonna die at home."
Connor's hospital stay stretches on for 15 days. Finally, all the blood has been drawn and the poking and prodding is over. The Rowleys are on pins and needles waiting to hear the results.
Everything came back negative. And so they told us that that was the last thing they could do for us.
We were told that he should go back home, see what manifests itself over a period of time, whether it gets worse or gets better.
Chris and Dave are crushed. They make the 3-hour drive home with their 5-year-old son, who's mysteriously getting sicker every day.
I had one of the siblings ask me if Connor was going to die. And at that point, we didn't know. But yet, for the kids, having lost a brother, they were already preparing themselves to lose another one.
Desperate, his parents reach out to their community.
I decided that I needed to somehow document where we'd been, and I needed to figure out how maybe getting some more public input might help shed some light.
Chris wrote an article on Connor. It was a great way for us to get his name out there and try to draw some attention.
The article runs in the Des Moines Register, Iowa's largest newspaper. It catches the attention of pediatric gastroenterologist Dr. Warren Bishop.
I was reading the Sunday newspaper, and I came across an article about a young child who had been having mysterious symptoms.
By chance, Connor is referred to the University of Iowa hospitals, where Dr. Bishop works.
Connor was very, very anemic. He didn't have enough red blood cells, and that made him pale and weak. And the question was, where could that blood be going? He wasn't having bleeding from his nose or coughing up blood, and that really meant that most likely the blood loss was a subtle blood loss through his intestine.
When we arrived in Iowa City and met Dr. Bishop for the first time, he told us that he had read about Connor, and he immediately said, it's Crohn's. And I took a step back because I'm thinking, who is this guy? We've been through all these tests, we've looked at all these biopsies. How can he be so confident that it's Crohn's?
Crohn's is a chronic bowel disease affecting at least 1 in 14,000 people. With Crohn's, the body's immune system is overactive and can mistake harmless bacteria normally found in the intestines for foreign substances. White blood cells invade the lining of the intestines, where they cause inflammation. Left untreated, Crohn's can lead to ulcers, infection, and even death.
The daily fevers, the abdominal pain that he was having, and then his anemia. I think all those factors together made me really think about Crohn's disease.
Luckily, I believe we probably got her there just in the nick of time. They took LaRue back into the ER, and we were sitting there for hours not knowing what was going on. Meanwhile, LaRue was fighting for her life.
Suspecting a lung infection, the doctors gave LaRue intravenous erythromycin, a common antibiotic.
The last thing I remember before going unconscious is actually I was trying to get the nurse's attention because I wasn't getting any air. And I can remember trying to pull on the IV stand, and when I did, I pulled the whole thing down from what I was told. And then that's when they found out that I was going into respiratory failure.
She went into full pulmonary arrest 3 times. The nurses comment, well, she looks pretty good now for a person who's actually died 3 times.
The doctor and the nurses and everything, they worked on me almost 10 hours. I felt like this is over. I guess I'm gonna die and not know what in the world, was ever wrong with me.
LaRue's doctors attached her to a respirator and moved her to intensive care. They treated her with more antibiotics, but nothing seemed to work. Finally, after 4 days, LaRue's condition stabilized. But no one could explain why she'd gotten so sick in the first place, or what she had. Then one of the doctors happened to notice her weak eye.
And he said, well, you know what? Let's send you to a doctor that specializes with the eyes, and maybe he can pinpoint what's going on. Because a lot of times you can tell a lot of disease through the eyes. Well, I wasn't too thrilled with that. I thought, here we go again, another doctor.
The doctor referred LaRue to an ophthalmologist. Almost 4 years after her first symptom appeared, she met Dr. Michael Woodcock.
When LaRue came into my office, she was frightened, she was frustrated, she was concerned, and probably a little bit skeptical that she was going to get any help.
He sat there, he listened to what I had to say. He was concerned about the whole person and not just the eyesight.
When I saw her and listened to her symptoms, the droopiness was not constant, and neither was the double vision. Those 2 things together made me immediately suspect something that was unusual. So what I did initially is I had her gaze up and down, up and down. I did that for about 20 seconds, and that weak eyelid actually got weaker. Her double vision got a little worse, and so I was very, very suspicious that she had myasthenia gravis.
Myasthenia gravis is a chronic neuromuscular disease that affects roughly 1 in 14,000 people. It's triggered by a short circuit in the immune system that causes the body to attack itself at the point where nerves connect to muscles. The disease disrupts normal muscle function, in the arms, legs, eyes and eyelids, face, mouth, and throat. It can cause respiratory failure and, in rare cases, even death.
So I listened to him and everything, and at this point, I'm like, okay, this is kind of far-fetched.
To make his diagnosis, Dr. Woodcock tried Tensilon, a chemical that helps nerves communicate with muscles in patients with myasthenia.
We gave her a small dose of Tensilon, and that droopy eyelid that was sitting down here went whoop like this, and that eye that was sitting out to the side and down came zap right in line with the others so that they were lined up looking at the same place. And for 20 or 30 seconds, from a very small dose of the Tensilon, she was absolutely normal.
But there's one key factor that does not add up. Crohn's sufferers usually have severe diarrhea, a symptom that Connor never had. Nonetheless, Dr. Bishop is suspicious. He consults with Dr. McKercher, and they decide it's time for another barium X-ray. Right away, it's clear that in the 7 months since the last one was done, Connor's intestines have changed dramatically.
This one showed a narrow spot in the upper part of his small intestine that strongly suggested Crohn's disease.
But the location of the abnormality could also be a sign of something far scarier for the Rowleys.
It was in an unusual place for Crohn's, but it was in a place that intestinal lymphoma can occur.
Lymphoma is a type of cancer that originates in the lymphatic system, but can attack any organ, including the small intestine. While Crohn's is dangerous, lymphoma is a killer. Now more than ever, the Rowleys are in a race against time to get an accurate diagnosis.
We needed to go after that segment of intestine in the middle of his bowel that was too far away, too far down to reach with an endoscope. And so the approach then had to be surgical.
On October 9th, 1999, 1 year after his symptoms began, Connor is wheeled into the OR for exploratory surgery.
We hadn't been separated very much during any of the hospital procedures, and so it was scary to just watch him go.
We were very nervous, very scared. We also knew that in order to really find the answer, this was the way to do it.
During the 2-hour operation, the surgeon examines all 12 feet of Connor's small intestine.
The surgeon found that segment of intestine was very thickened and red and angry looking. Connor also had enlarged lymph nodes associated with the inflamed portion of the intestine.
The inflamed lymph nodes are a sign of lymphoma, but the surgeon sends a tissue sample down to the lab to be certain. While he waits for the results, he steps out to talk to Chris and Dave.
The surgeon came down and told us that they suspected it was lymphoma. And that was a real shocker. We were devastated. I mean, we were scared to death.
First reaction is you just want to cry. Just leave me alone, cry. But
I remember feeling very dizzy and kind of nauseated. But the test confirmed his suspicions of it being myasthenia gravis. And from there on, he referred me to a neurologist up at Chapel Hill.
She was one tough little kid at the time and had been through much more than most individuals will experience in a lifetime.
LaRue soon learned that myasthenia patients can have violent respiratory reactions to certain drugs, like the antibiotic that she'd received in the hospital.
Myasthenia gravis is very unique in that it fluctuates on a day-by-day basis. In fact, the only thing predictable about myasthenia is its total unpredictability.
He ran more tests, did more strength, exercise techniques. By him doing that, I really was able to see that my body was extremely weak.
A decision was made to treat her with very high doses of prednisone, a steroid designed to shut down abnormal parts of her immune system.
LaRue's condition improved noticeably, but for a better long-term outcome, Dr. Howard suggested surgery to remove her thymus gland.
And the thymus gland is an immune organ. It's what develops our immune system as an infant. But as we reach young adult life, it sort of shrivels up and disappears, except in a patient with myasthenia.
Dr. Howard explained that the thymus gland may be responsible for triggering attacks in patients with myasthenia gravis. Removing the gland would be risky, but leaving it in LaRue's body would be even worse.
Without treatment, LaRue would have continuing fluctuating muscle weakness. She would have easy fatigue, and that would persist and actually would get worse over time.
In March 1991, 4.5 years after her first symptom, LaRue's thymus gland was removed. The change was dramatic.
LaRue has no evidence of muscle weakness whatsoever. She's the mother of 2 very active twins.
To be able to be a mother, have the condition that I have, it's just a blessing.
And that's just great to see her back the way she was when we first met.
LaRue still takes regular doses of steroids, but she is able to lead a normal, active life, thanks to the doctors who finally gave her a correct diagnosis. Within the hour, the results from the biopsy are back, and they're shocked by the finding.
The biopsy showed no evidence of any cancerous tissue present. And it was a tremendous relief to me that this really was not lymphoma. And we could go back and tell the parents, you don't have to worry, Connor's going to be okay.
I don't remember the surgeon's exact words, but the sense of it was that it wasn't lymphoma, that we did not find malignancy, and we believe it's Crohn's. And it was good to get the lymphoma fear entirely off the table. So we finally got that definite diagnosis.
We told Connor that we had an answer, that it was Crohn's disease, and that it was something that we would learn about, and that we could start treating him for it right away, and that he would start to get better.
The only thing I remember is when I came back after the surgery, they had welcome home banners everywhere. That was pretty cool.